So the urine tube that drains the bladder goes right straight through the prostate. As men get to be about age 30, 35, their prostate starts to grow in a different way. It's not cancer, but it starts to grow, and it's called benign prostatic hyperplasia. And eventually it can get big enough that it blocks the bladder outlet obstruction. And that's when men begin to say, hey, my flow's different, I get up in the middle of the night, etc. I start having these symptoms. So everybody gets this, many men get that. Now this is a picture done through a telescope that's passed up the urethra to look at the prostate, and this is what happens. The prostate begins to grow, it's got to go someplace. And one place it goes is into that urine tube, and it begins to compress it and choke off the flow. And in fact, we measure a lot of our success when we give medications or do procedures is how well did it change the flow. You know, these are men, different ages. This is actual data from patients. And these are the men in the 40s, and these are the men 75 and above. And the 40-year-olds are normal, they're way up here. Well, not surprising, the 75-year-olds are about half of that. So, and that's an impact of this change in the prostate. The most common medication to treat it is called alpha blockers. Actually first used to treat high blood pressure, because when you gave the medication, the blood vessels dilated. And some smart person noticed that the prostate has some of those same characteristics as the blood vessels of the vascular system where hypertension comes from. So he took the alpha blocker, gave it to the man with urination symptoms, and it improved, meaning it helps relax the prostate so they urinate more efficiently. Not surprising, testosterone is important to men, and it also has an influence on the prostate. Testosterone itself isn't that powerful an influencer on the growth, but one of its metabolites called dihydrotestosterone is. And if you take a particular pill, Proscar, finasteride, dutasteride, or Avodart, those are names you may recognize, it blocks the conversion of this hormone, and basically the prostate begins to shrink. Begins to shrink loses about 30% of its size. Many men, if their prostate problem gets bad enough, or the pills stop working, we have this procedure called a TURP, and basically it's a camera instrument that can cut away that tissue. And for most of our patients, this is a very effective means to treat the prostate. We still use this technique, but we don't favor it as much as we do other things because it's considered more invasive, and so we have some alternatives. And one of these alternatives is to still try and unblock that tissue, but instead of using that instrument that kind of whittles out the prostate, we use a laser. The men do not stay in the hospital, they go home the same day, and the improvement in their flow, the improvement in their symptoms is actually comparable to that older technique, the TURP. So we look at this as a big advance for us in urology. And this is one type of alpha blocker. So baseline and then after the alpha blocker, and in a sense, he gets this much improvement in his flow. And here's a man that had a TURP. Well, he's got that much improvement. So the message is that when you use these simpler techniques, it's a trade-off, because you don't get the same marked improvement, but you got some improvement and you got it with less risk. We have medications on this end, and then we have lasers and more standard surgeries on this end. And there's a big gap in the middle. So this is something that we're going to be doing here. It's a research program, and we're teeing this up. We're not ready to enroll patients, but the idea is that we use vapor to affect prostate tissue in a way that is minimally invasive, painless, and hopefully as good as the more substantial surgeries.